All right, then. Since you will be having a lot of questions towards the end of the presentation, I'll start with a question myself. So we will be talking about the topic that you're seeing here, but we'll come to that later. Before we begin, we'll just touch upon what psychology actually is. So let me present you the question. How do we know if someone is truly insane? Like, have you seen an insane person? Have you encountered a person who's mentally ill or has a mental condition? Or how do you identify them? That's a burning question even we still try to figure out. So that's what we will be exploring. I have given you some pointers. If you say any of these are questionable, you can actually raise your hand and we can discuss. So the loss of reality in testing like delusions or hallucinations. If any of you are not familiar with these terms, just let me know. So if you have hallucinations or delusions, we call them, they are out of reality. And severe disorganization, like in mumbled speech or muffled speech or muffled voices, inability to communicate clearly or says things that are not real. So like things like that, and in behaviors, aggressive behavior or any other behavior that we consider not normal. And or thoughts, irregular thoughts, and danger to self or others is one major thing that we look at, and the profound lack of insights. Okay, so in their condition, they are not knowing they're having a mental illness, or they don't know that they're out of reality, they are unaware about the surroundings. These alone, will it be enough to say a person is insane? That's the biggest question that we have today, even before jumping into what AI is. So I'll present you a small scenario from the history of psychology to understand what this actually means, and can we just diagnose a person insane or like put that label on a person just looking at these things, or looking at even more. Let me present you the Rosenhan experiment. That's Mr. Rosenhan. And he's a famous psychologist who came to us in the 1970s with a big ambition to check if can we really understand if a person is insane or not. So what Rosenhan did was he asked one question, like, how do we know if someone is truly insane? The same question that I asked you 5 minutes ago. And to find the answer, he sent 8 perfectly normal people into mental asylums around UK, which was also considered as mental health institutions. And these 8 people were perfectly sane. What do you think happened? To answer this question, I'll break it down to you. So they went into these asylums across UK, just faking one symptoms. Remember the symptoms that I presented to you, loss of reality or severe disorganization, danger to the others, or whatnot. So Rosenhan chose one delusion or one hallucination, which is just to say that you start hearing voices. That was the only thing these 8 people started faking. So all of these 8 people went into 8 different hospitals across UK just faking a symptom saying they hear voices. And let me break down this experiment further to you. The team was of 8 people. One was a painter, one was a housewife, a pediatrician, a psychiatrist, 3 psychologists, and then Rosenhan himself. This was the team of 8. And all of the 8 got admitted to hospitals, diagnosed properly with a mental health illness. But they were only faking one symptom, and once they got into the hospitals, they started acting normal. But there's a lot of twists in this story, and the mission was to get admitted into the psychiatric hospitals in America, and it was not that hard. You just had to fake one symptom, go to the entrance of the hospital, and then you're admitted then and there. And it even went further. Even after you started acting normal, after getting admitted to the hospital, these 8 people started taking notes. So they started taking notes, they started their normal routine, and they were just there to observe, right? But what happened was, all of these 8 people were diagnosed properly. 7 with schizophrenia and 1 with manic depressive disorder. So they were diagnosed with proper clinical mental illnesses, and they were started treatment within these hospitals itself. And it was really shocking, because imagine a normal person just walking into a psychiatric hospital and acting normal just to be diagnosed with a clinical condition. So clinical conditions are even worse than, the normal conditions that you might, understand, small things like having stress or having anxiety. Those are normal level, more common and more natural, more occurrences would be present within the normal people, and you could easily get treated. But these were clinical diagnoses. And they were diagnosed with all of these things. And the average amount of days that they had to stay in the hospital was 19 days. And the shortest being 7 days, and the longest being 52 days out of these 8 patients in these 8 hospitals. Not a single doctor suspected the truth. Not a single doctor know about this, and like they were not able to differentiate between the patient or the people who were having conditions. And they were acting completely normal apart from the admission status where they made like, one comment saying that they hear voices. That was the only abnormal thing they presented, but afterwards they were very normal. And it's shocking to me because like, after acting normal, they were still not able to figure it out if they're having an episode, if they're not having an episode or whatnot. So they continued and they even went further to prescribe medications. So the treatment was antipsychotic drugs. And there were over 2,100 pills prescribed across these 8 pseudo patients across the days of across the average days of 19. And every single pill was taken by these people and was secretly pocketed. They never drank it. So there is another question, right? So what about the actually mentally ill people? Who's going to check if they're actually taking the pills that they're supposed to? And what's the administering process? What's the supervision process that's going on? How do you know if the person is taking proper medications? You can't just hand it over to a person. There's a lot of questions like that. But none of these pills were taken by the pseudo patients. They actually pocketed it and threw it away, but it was that easy. And they had to stay for this number of days, which is very questionable. And the only way out, now they got in very easily, right? But to get out, they had to admit being mentally ill and agree to treatment. That was the only way out of these mental hospitals. And imagine that level where a sane person is trying to get out of a mental hospital in the middle of an experiment that they signed up for, and one of them were like, a housewife, a painter, like normal people who were volunteered for this. And in order to get out, they had to agree that they have a mental illness, and they agreed to it, and then they agreed to the medication, and that's when they were able to go out of these hospitals or get released into. And it's very disturbing. So my question here is, to come up to this level, there must be so much of processes that was misused or misunderstood, or diagnoses that were given wrong, and it raises so much of ethical questions and so much of other questions that we still have up to date. And do you think these are resolved? Is one question, and the story doesn't end there. So when Rosenhan started his publication, he went out and published his work, and the hospitals felt betrayed, and the doctors felt humiliated, and there was a lot of outrage that broke afterwards. So what he did was, some of the hospitals actually challenged him to say, send us your fake patients and we will spot them. So one of the main hospitals in UK actually challenged Rosenhan openly and told, send more of the fake patients. We will show you how we identify that, because psychology and psychiatry is this developed. We are not, misusing or misunderstanding any of these treatments. Send us and we'll spot. That's what they told. And Rosannan agreed to this. But the plot twist is, 3 months after, the hospital proudly declared that they had detected 41 imposters. So they found 41 people who were actually faking mental illnesses, and they told Rosannan, look, we found your imposters. There's 41 patients or more that you have sent, but we have identified 41. But the massive plot twist is Rosannan never sent any fake patient. So there were no fake patients that were sent, but they understood it in a different way, and their own they actually started understanding that this has not happened, and they started actually misdiagnosing once again. So probably out of these 41, there were people who actually had mental illnesses. So that was one of the major plot twists in these stories, and his study fueled closing of many asylums in the race of patient rights and reforms in psychiatric diagnosis that shaped the DSM-5 that we use today. Is there anyone who's familiar with the DSM-5? At this age? So the DSM-5 is the Diagnostic Statistics Manual, which we use up to this day. So there's different versions of that being released every other year, which gives you an update of the mental illnesses, what are the criteria that should be used in order to diagnose a mental illness. So if you fit the criteria and you refer to the DSM-5, the Diagnostics Manual, you will see that, okay, this patient is right under this criteria, so he can be diagnosed under this thing. So that's a diagnostic manual that we use. So to create the DSM-5, this experiment was one key feature that actually brought out a lot of questions, saying that, is diagnostics real, and how many people were actually diagnosed, and how many people were brought under wrong labels and given medications and wrongly accused of an illness or labeled of an illness and was forced to take medications and forced to accept that they have an illness. So imagine the damage that could be done. So this is a professional level where psychology was converted into a science, where people were actually having places, mental health support and all of those things. But such mistakes were commonly happening. But what we are going to discuss today is how we are going to bring AI, as in artificial intelligence, into the field of psychiatry or into the field of psychology. So that itself is a bit scary, because when the professionals themselves make mistakes, how are we going to trust an artificial intelligence when real natural intelligence is also questionable at a stage of a subject which is known as psychology? So it was first born as a philosophy, if all of you know the story. It was later on converted into a science with proper evidences, experiments, and research and whatnot. And now we believe acting on evidence-based practices, so we call it a science. But up to what level can we actually take this subject and believe in it and move forward without harming people in an ethical way? And that's where AI comes into, and that's what we will talk about. And I'm Janindu. I'm an academic coordinator and the lecturer for the psychology program of University of London programs at RIC, which is the Royal Institute of Colombo. I teach around 100 to 150 psychology students at the Royal Institute studying the psychology program at RIC. And we go into different places. So my range of work vary from minority communities such as the prisoners, the transgenders of Sri Lanka, the street-based sex workers, or the drug addicts or people who are recovering from drug addictions, and victims and survivors of abuse and rape. So I work with a very diverse group of people. And when it comes to understanding AI and how AI works and how much of therapeutic aspects we use in Sri Lanka, what is the cultural difference? Do we really have do we really have a sufficient amount of professionals in psychiatry and psychology and counseling in Sri Lanka to work with all these marginalized communities? It's a very questionable area. And I have seen a lot and I have discussed a lot, but we're in a stage where we start to improve. But this is also a stage that we should be 3 steps further from where we are right now, because we are even talking about AI and chatbots and large language models for the support of mental health, where we are still developing and we don't have the professional expertise to cater to the current groups of the Sri Lankan community, cultural based, and we are still lacking in that area. But we'll try to understand a way ahead, because knowing things is better than being late and not knowing things. And is AI and psychology connected? Like, the question that I asked myself before doing this seminar was, can you actually relate AI into psychology? Is this a real thing? Or are we going to go behind something that is not going to be practical? But to be honest, there's like pros and cons, but there's a lot of advantages that we have actually used with technology. So integrating this system into a field like, mental health is very important, and we'll look at it. To be honest, AI and psychology have similar things and interests. Like, psychology studies how humans think, feel, and act. And AI tries to design machines that can mimic or complement these abilities. So what I found out was AI itself started with the understanding concepts of psychology. It was trying to mimic a human brain to see if intelligence can be recreated or artificially induced, and see how successful it could be. So it started with the study of psychology, which is the human behavior and thought processes and actions. And yeah, you have a question? Yeah, we have a separate time. Yeah. Okay, yes. Sorry. Yes, so that's about it. And then both fields ask the same core questions. For an example, how does the mind work? AI also try to figure that out, and in psychology also we start to figure that out. And can intelligence be replicated? We do ask that from in both the fields, in psychology as well as in AI. When we go for therapeutic approaches like CBT, cognitive behavior therapy, can we change behavior? Can we recreate or change the way we think and act and feel and all of those things? AI also try to learn from trial and error and things like that. So it's in a way similar. And then we also have what makes decision rational or emotional. So in AI, we have come across a lot of errors that they have stopped us from asking certain questions. Certain words are taken as offensive, certain questions are taken as offensive, certain questions or certain chats that we have created with chatbots have raised questions with the authorities, and the authorities have been alerted. All of these are in play at the moment. And so is in psychology. There is so much that we question from what a person actually says. What comes out of your mouth is very questionable. And like we try to understand a person through those and try to help the people. So does AI. So does AI, and try to understand how they can continue the process of answering a person through a large language model. So if you are not familiar with what large language models are, ChatGPT is a large language model. Copilot is a large language model, and similar. There's a lot of platforms nowadays that are large language models, which are based off of data, and they are acting based off of data and learns through trial and error, just like in psychology, where we try to learn through trial and error and a lot of more things. So moving forward, how does this really apply into psychology? So I have taken one of the fields, which is clinical psychology and mental health. When it comes to clinical psychology, these are the three ranges where AI can actually get implemented into, and it's actually in practice. People are practicing. There's research coming up about it. There's not enough sufficient research, but this is an area that has come up. So chatbots. So the first logo that I have put here is Wobot. I'm not sure if you have checked out on this, but Wobot is a platform that caters to different mental illnesses, and if you're having a specific mental illness, you can download Wobot, and you can check out the criteria that is necessary, and it will give you therapeutic approaches, a large language model to chat with, and other practices that you can similarly practice to help you understand the illness and recover faster. So we'll talk about Wobot later as well, and then we have the AI friend, which is Visa, for mental health support. So these are chatbots, as in large language models, and a little bit extra in certain cases. And then we have predictive analytics to detect early signs of depression, anxiety, and suicide risk. So how this comes into play is with the language pattern and with the word pattern that you put into large language models or whatever AI that you have, it has an understanding based off of the data that you have input, which is like the whole chat. They can early identify if you have a risk of suicide, or if you're like, building up into stress or depression, or if you have anxiety or things like that, and early detection based off of the written data that you input. So AI comes in handy in that case. And also the other thing is VR and AI for exposure therapy in phobias or PTSD. I'm not sure how many of you are familiar with these technical terms, which is PTSD or phobias, or like AI and VR and exposure therapy and all of those things. So I'll explain it in short. Let's take a phobia, like spider phobia. All of you are familiar, like, let's say you're scared of spiders in just normal terms. That could be called spider phobia, something like that. And how are you going to use exposure therapy? As in real world, what you would say is like, have you heard of certain experiments where a child is, scared of a rat or a certain animal? So you keep the rat at a distance, and you actually give the child something that the child would enjoy, like a piece of chocolate, and start the exposure or desensitization process towards a thing that the child is scared at. And little by little, gradually, you make it come closer, and you try to get the fear out of the child from that certain object or thing or animal. So that's basically exposure therapy. You go for a desensitization process. But with VR and AI, they have been able to create a more safer and a more let's say practical scenario where you don't actually have to get like real scenarios. Imagine you're scared of snakes. Finding a snake to go for like, exposure therapy could be difficult. I'm joking, like, that's not going to go into that extent. But fear of heights, or like, for PTSD, post-trauma, for soldiers who like, have traumatizing experiences from war and, past experiences such as so and so, they can use VR and these AI technologies to get exposure therapy and desensitize them into the process. So in these areas, AI has actually really helped, and especially in exposure therapy, and also when it comes to predictive analytics. We can't completely rely on predictive analytics, but VR actually has proven like a lot when it comes to, the productive level and the outputs that they have cured. And when it comes to chatbots, it's still questionable, but it's promising. So we'll move forward and see. I'll show you like interfaces of these things so that you can get a better understanding. So when it comes to Wobot, this is the interface of Wobot. So for an example, I have taken screenshots for substance use disorders. Now imagine you have a substance abuse disorder where you're like, massively dependent on alcohol or like a certain substance that's actually like, killing you in the process. But through Wobot, if you're like actually going into stopping these or to stay sober, it will help you to process and document One of these features is to select the criterias, and the second is a chatbot, where you get the chatbot and you input all the data. You have a proper conversation just like a therapist, and then you speak with it and understand, and based off of those, you will go for the suggestions. And in the suggestions, you can see they have like a gratitude journal, so journaling and other options are presented for you, and then you can mark on the days that you stayed sober or you felt, and your mood tracking and all of those can be properly tracked, and you can have everything in one place, just like a therapist would in a regular therapeutic sessions that are conducted with a substance abuse disorder patient. So it's simple and similarly there, but the understanding is not to completely rely on this, but this is going to be a support system for you. So Warbot is somewhere that AI has actually helped when it comes to curing mental disorders or managing mental disorders better. And when it comes to exposure therapy, it would be something like this. So with the help of a therapist and with the help of another person, where you actually get exposed or desensitized into things, and you don't actually have to use the real things. And once you take off the gear or once you take off the equipment, you're understanding, okay, it's not really there. So it helps you to overcome the fear a little bit faster, and it's quicker and it's more efficient. And if you do it with a proper therapist, you will be able to, reduce the trauma risk of that, and secondary trauma can be avoided, and you can properly use it for desensitization processes. And yes, so some of these AI usages are as such, but there are other areas of psychology other than clinical psychology where you use a lot of AI and understanding. So when it comes to the way forward, we'll understand a few things about AI and how psychology gets into integration. So when it comes to psychology's influence on AI, what does AI take out of psychology? We'll just look into that a little bit. So human cognition as a blueprint. So our cognitive abilities, our thought processes, how do we develop from birth to death? What is personality? Understanding personality. So for an example, we have this concept where we call the tabula rasa. A newly born child is compared to a blank slate, the mind of a newly born child, which is called tabula rasa. The term means blank slate. And you develop this blank slate into a picture or a beautiful image with the surroundings that you raise up and with the experience that you face. So your nature and nurture will fill you with a picture into this blank slate while you grow up. And that is your personality. And changing this personality could be a little bit difficult. This is a simple theory that it explains. And similarly in AI as well, in AI architecture, like neural networks and inspired by the structure and the functions of human brain, AI is also defined in the same term. They start with a process of understanding and developing their system just like a human brain. And they take that action and activity and the data through human brains and through human experiences. After all, AI is human-made, and that's how it starts its process. And learning theories in AI. So machine learning draws heavily from behavioral psychology. So reinforcement, trial and error learning. So reinforcement and punishment is one way that humans learn. So if you have heard of theories from the famous psychologists, you understand how reinforcement techniques, is punishment good? Is taking something positive away going to reinforce your behavior? Can you change it in a childhood age? Similarly in AI as well, you take the inputs while you communicate with real humans. The understanding, the tone, the rhythm, and the way that you express certain things after a response, AI learns from that. So that is in a way punishment and relearning. In another way, we also call it error learning or trial and error. So when you input certain things, have you come across using, how many of you are using ChatGPT or have used ChatGPT in their life? So you must have seen they sometimes give you two options to pick the best version out of which you do, and they call you giving inputs into that. So those kind of things will actually show you how error learning is visible in humans as well as they have integrated into the system as well. So the more you use it, the more it will develop. The more data that it has, the more it will be strengthened and move forward. Similarly with human factors as well, psychology informs human AI interactions, ensuring the systems are user-friendly and all of those things. Even when it comes to machines and all of those things, it should be human-centered. We say this always when it comes to engineering or when it comes to architecture or when it comes to technology. It has to be human-centered more than anything. For an example, even designing aeroplane, it should be first of all thinking of the human before the system. Because imagine the system is made in a way that the human is confused, where all the alarms go off in the same time, where all the noises or the colors or are too confusing or unreachable. That would confuse the human, to make a human error. How many of you have heard of plane crashes because of human errors? Things like that. That's where the system is not human friendly and not centered on the person who's going to use it. So if you have thought of the process where computers have evolved, how much of an effort they put into changing a machine to be human friendly. All of this comes through psychology, and there's a lot of interventions that psychology gives and insights that gives into understanding these machines and making them user friendly. So is it with AI, and so will it be when it comes to giving therapeutic aspects through AI to humans. They will have to learn a lot through trial and error and make it human centered. How does the human want it? And we'll talk about it a little bit more in the next slides, where we talk about ethical and societal considerations. So biases and fairness, this is what I wanted to talk about. So AI learns from the inputs that you give. So it's very easy for AI to replicate the biases that they learn from humans. If not corrected, they will continue these things. And when it comes to psychology and therapeutic approaches, biases and errors are massive things that could actually harm a person in a bad way when it comes to the therapeutic practice. And AI reinforces societal biases unless corrected. And when it comes to trust and acceptance, this is where I wanted to bring from the previous point. People's willingness to accept AI in therapy or decision making depends on the psychological factors like trust, perceived control, and empathy. I know there will be some of you who would say, like, I'd rather talk to ChatGPT than go for paid therapy because it's easier, it's reachable, it's always available, and it's like, more empathetic towards me. But we have an understanding of our subconscious mind, our unconscious mind, and our conscious mind. So the purpose of going for therapy or for the purpose of reaching out for help is to understand that you have a safe space where another human being is there for you to help and understands what you say. But the chatbot also does the same thing, right? You would question, like, what difference that does it make? Like, I still get my venting out, I still get my responses, I still understand, and I have a safe space to talk about it, and I don't have to feel judged. But that very thought is what would not make it ineffective. Like, you have to have an understanding subconsciously that there is a person that I'm speaking to and understands, and I can go for another session. And that trust and that empathy comes in a way that you actually wouldn't think in a surface level. AI is unable to do that in certain levels. So that's what I wanted to point out. And there's a risk in over-reliance on AI because the therapist would know when to stop, when to start, when to terminate a session, when to restart a session, which areas not to talk about at the point to stop secondary trauma, which areas, like, sometimes it's like rubbing salt on an old wound if you ask the wrong questions from a person where they are not ready. So AI is unable to have that human in-depth qualities at the moment, and like it might damage you in the process. So that's something that we should look out for. And when it comes to the future directions, I'm not going to speak for any much longer, just 5 minutes and I'll be done. But when it comes to the future directions, integration of AI as a partner in therapy and diagnosing rather than a replacement, it's not replacing your therapist, but when it comes to diagnosis, for early detection of depression, for early detection of suicide prevention, to understand the patterns, to have a memory capacity backed up. All of these is important when it comes to using it, so it's not replacing a therapist, but rather enhancing the therapeutic approaches itself. And the growth of effective computing, AI that recognizes and responds to human emotions. This is still in practice. We see there's a lot of area that is lacking here, but with the trial and error and with more input, I think it will come into a stage where you can actually put a level of trust on it and rely on it a little bit more than what you do right now. So something we can look forward to, and using ethical human-centered systems and cross-disciplinary research when it comes to psychology and understanding AI, we have a massive gap in research. So there should be a lot of research that should be done, and there should be a lot of learning for both ends, for AI as well as us humans, to understand about psychology, for psychoeducation, to understanding the cultural differences. Just because you learn a Western theory doesn't mean you can apply it directly in the Sri Lankan context. That's something that I learned the hard way while I was studying, international degrees and trying to get out into the field. You will understand how hard it is to deal with an actual person. So in that case, AI has a long way to come. And a few questions here. Do you think in these areas, AI can actually be accurate? For an example, in psychology, we have these sections where it comes to humanistic and existential psychology, or psychoanalysis, which is unconscious and symbolism, and counseling therapy and relationship, social and cultural psychology, creative and positive psychology, morality and ethics. We spoke about most of these things and where AI lacks. I have given some examples. We'll take like 3 sections and discuss it. So if we take humanistic and existential psychology, this area focuses on finding meaning in life, purpose, and personal growth. When it comes to AI, they are able to actually go into a certain level, but what they are unable to do is a machine can suggest a coping strategy, but it cannot truly understand sharing the in-depth understanding. Just like I told you, where to stop, where to start, and what areas to question further, and to get your story really out, they lack the human in-depth understanding. So when it comes to humanistic existential psychology, there's a long way to go. I don't think it could be the most developed area because the thought process is way far to go when it comes to AI understanding. And this is somewhere like a real human has to be interacting with. But if we go to something like psychoanalysis, like the unconscious and symbolism, psychoanalysis looks at hidden feelings, like, the dream analysis or unconscious motives. Are you really there for, like, let's say there's a patient who's actually presenting with suicidal thoughts, like a therapist would understand, is this level of risk high or low or moderate, or is there other intentions that are relying underneath? AI is unable to do that at the moment, or like even in future. That would be a very questionable stance to understand underlying thoughts and processes, and integrating that into AI could be extremely difficult, even through the trial and error and all the data that you can input. And AI can't grasp the subjective symbolic meanings of dreams, or like a Freudian slip or the slip of a tongue, to understand where they went wrong, because they heavily rely on data once again. So if you take like data visualization, like all the chats that you have spoken about, all the things that you have done about, a psychologist or a therapist will be understanding those things in real time, in real world, where they make a slip of the tongue. But in chatting, or like speaking, you can always correct, change, and rethink and redo whatever you input as data. And AI will not be able to correct it or be effective in that manner to understand the slip of a tongue, or like a Freudian slip. So that is a very questionable area once again when it comes to AI. And when I come to the counseling and therapeutic relationship, I think we explain this further, but I put it as a point there, like, having a real person there to understand question is coming subconsciously, that you have a safe space, that you can open up, venting is important, things like that is an area that lacks in AI chatbots, or like, AI for mental health. So yeah, in conclusions, AI is helpful in structured tasks like, detecting depression and helping CBT, which is cognitive behavior therapy. But it struggles with in-depth meaning, empathy, cultural relevances, morality, or creativity. These will be improved to a certain level, but not without the integration of a real human or real therapist in presence. In conclusion, understanding cognition, behavior, and learning is something that AI takes from psychology, and AI gives psychology new tools. So we should definitely integrate it properly into our practice and give an effective service to the patients that we look after. And we should be having AI properly integrated into the system, and starting early will give enough data for them to analyze and properly process. Yes, so, but it falls short in deeply human, rational or existential areas, and where empathy lacks. So that's just a summary. This is not a in-depth understanding of how AI is actually impacting psychology, but rather a base touch where you can actually have conversation, have an understanding how AI is relevant in psychology, and how we are both learning from each field. So AI and psychology, what is the relevance, what is the understanding, where are we standing right now? Is Sri Lanka in a place where we actually can use this in place, or is there other issues that we should overcome before actually thinking about AI? But understanding these in a base level is very important. So I hope I was able to open up that conversations for you in your head, and I hope you find more information on this further. And if you have any questions, I would be happy to answer them.
First of all, I call a lot of thanks for the explanation about the AI. Uh, so, I have 1,000 of the questions about the AI, but I think I have little knowledge about the AI, because this generation of not ours. So I want to one question to ask. Actually, AI inside what technology? This is, for example, I will tell you this. My questions is multiple cases inside, but I don't know how I build up my questions for a brief. Anyway, I will point out the one questions for you. Actually, how could analyze this galaxy? A billion of neuron inside the in the brain, in human brains. How could understand somehow diseases inside that the psychology? I think about you explanation about the psychology, but for example, I will tell you this like autisms or HDI, something hyperactive like this. This is that's why I said that my questions is maybe confused. I want to these questions for some answer for and brief. Okay.
That's actually a very good attempt. I mean, I understand what you're trying to say. Like, it's a deep understanding about the world and, like, certain illnesses that you mentioned. We haven't even studied it completely yet. For an example, autism or, like, Down syndrome is not, those certain disorders are not completely studied yet. And we don't set for settled science. Settled science is when we stop and say, okay, this is exactly what it means. This is like, done and dusted. We have studied and we have understood this completely. That is settled science. We don't, in psychology, what we believe is we don't set for settled science. In the previous year, I think we discussed about where asylum tortures took place, where they thought everything was biological, and when they found, mentally ill people, they tried to drain the blood of that person, thinking that there are some toxins in the blood, or they would induce vomiting so that they could take these toxins out. They would spin the person in a chair and start inducing, like, seizures, put them in ice baths, give massive tortures to the person, thinking everything is biological. And you can search about this under the term lunatic asylum tortures in Google, and you will see all these processes. And one of the famous cases is on Bedlam Hospital. So we have come so far understanding all of those things. So there was a time where we didn't understand anything, and we have come so far because we didn't stay for settled science. When it comes to AI doesn't understand anything as long as you don't input data. All of it relies on data and data visualization and the way they process data. So whatever you input, they will stick to it. That's why AI alone cannot be taken as an independent, trustable service provider when it comes to mental health. You can't rely on AI. That could be extremely dangerous because of the factors that I mentioned, because they don't understand where to stop. There are certain keywords that would block them. So it's understand it in this way. So there's millions and millions of people around the world using AI. All of those keys, all of those words that are input by all these thousands and thousands of people are data. So we are talking about massive data. And they learn from all of those things. They have the ability, as in AI has the ability to integrate all of those things, analyze the data, check for similarities, check for differences, check for patterns, like how many people who say these keywords would respond with this second option in a certain way, like with the same tone, same rhythm, and express the same emotion in writing, and they would analyze it. That's something we humans can't do. Imagine research. We have a lot of barriers to research, right? Even when I say, like, there should be cross-sectional studies for research in AI and psychology. Psychology is human-based research. And to get through that, even though ethics is not supposed to stand as a barrier, we have to take so much of precautions to make it ethical, to promise that we will not harm people, to promise that, this will not cause psychological, trauma or secondary trauma or anything like that. We have to get approval and prove our ethics. That limits so much of experiments that we can do or could do with the promise that we are not going to harm people. So that's the limitation that we have. But when it comes to AI data, that's massive. And they do adhere to ethics, but they have not told that we are not going to collect data or analyze it. So they do understand massively about data vastly with cultural differences and with, predictive understandings or whatnot. But they do collect a lot of data that us humans can't do alone without AI. So it's actually helping us to understand data better but it doesn't understand the whole universe, as you told. It's not the case. But it definitely has improved our understanding of the world, and it has definitely helped us in research, helped us in data visualization and data analysis, and how our service as humans can improve just because we have so much of data that now can be simply analyzed. So it goes back and forth. We learn from AI and we also teach AI in the same way. That's why I told, like, if it's not corrected, it will continue the biases and stigma and all of those things, all the wrong understandings. It would also continue forward because it's also learning from humans. I hope I was able to understand your question and answer it in a certain way. Yeah. So if there's any more questions, I'll be happy to answer as well. All right. You can always talk to me, or you know where to contact me. I teach at RIC. You can always call and ask for the coordinator of psychology, and I'd be happy to answer any of your questions even further. And yeah, thank you.
Thank you very much, Mr. Janindu. So, mental health, it's actually a taboo. Like, I think in Sri Lankan context, it's very much hidden. So, thank you all for participating. So, we'll convene 1:30 after lunch. Thank you.